Good evening, ladies and gentlemen. I think I'd like to start with saying why choose robotics. And it's simple. When I was diagnosed with cancer, my urologist told me, you have these options. And there were 5 options along the way. You can go out of town, do this procedure, the seed, radiation, the traditional surgery, robotics. And after probably a 30-minute conversation, I asked him, so doctor, and he's a surgeon, what would you do if you were me? And he immediately answered, Jerry, I do this procedure, but the traditional way. But if I was you, I would definitely go robotics. So what is that? So he went along to explain the process and so on. And where would you go? So he told me the possibilities out there. And then he went to speak very, very highly of Dr. Razdan. So we made an appointment right away. Of course, you got to book a few months in advance. And got to meet him and prepare myself for surgery. And I will say that, like most of you men worry about the erection and so on, my main concern was, let's get the cancer out of the way first. I didn't think about the containing urine and all that. That wasn't my priority right there. And I can say that I'm only 20 years old. I'm the baby here. I'm only kidding. I'm 46, 47. So that wasn't my main concern. My main concern is let's get the cancer out of the way. I lost my father 11 years ago, and he had esophageal cancer. So I consider myself very lucky that I got right on time to get this done. When I met Dr. Razdan, I didn't need to go to a second doctor for a second opinion. I was just grateful from having a doctor that performs this surgery, and he's handing me to a higher level expert with full trust and saying, this is the way I will go if I was you. Having said that, I will say that prior to surgery, I feel that I prepare myself mentally, and the most important thing of a man is probably to have his spirit up and the right attitude. And with that, you can accomplish everything. On top of that, I think you have to have the support of your family, which my children are young enough to understand, and I want them to share a little bit of the experience. They're 14 and 15, and not because I want them to make them feel sad, but I want them to understand the values of life. Great support from my wife, and I cannot say enough about the support that I receive and a peace of mind, not only from Dr. Razdan, from his whole staff, Anelli, Sachi, Jessica, Dr. John, everybody was involved with me. This is not only, you're not getting just a doctor, you're not getting just a surgeon, you're getting a person that is so passionate about what he does and what his staff does every single day of their life. They being with me from prior to surgery until today. And I think it's part of my therapy along the way. I got rid of the prostate cancer, but I cannot get rid of Dr. Razdan. I haven't got to know Stuart here and so on. That's a long story. But it has been a phenomenal, great experience in my life. Some of you guys felt very sad and very worried, maybe because I had the experience of losing my father 12 years ago with cancer, and it was a strong experience. I think I was more ready for it. So I do thank him for everything the staff and doctor did for me. And yes, no leaking, erection is, I don't know, about 85%. I think I'm doing a little better than you guys. So I can't complain. I can't complain. Thank you.